Hello, everybody. My name is Dr. Lawrence Bryant from Kennesaw State University here in Kennesaw, Georgia. I want to thank Xavier University for their 16th Health Disparities Conference and inviting me to participate, and I'm truly honored for that. I'm going to talk a little bit about a study that we did at Kennesaw State University called Recommendations for a Multicultural Needs Assessment Project, Substance Use Disorders and Vulnerable Communities. So I had the privilege of directing the state of Georgia's opioid and prescription drug overdose epidemic efforts back in 2017. And one of the deliverables was a strategic plan. And what I wanted to make sure in that strategic plan is that the community voices of traditionally underserved populations would be heard. And after I left the Department of Public Health, they put out a proposal, and I wrote a grant and got funded to do this multicultural needs assessment. So we wanted to make sure that the community voices of traditionally underserved populations would be heard. So we looked at LGBTQ+, we looked at veterans, looked at African Americans, we looked at Latino, we looked at college students, and we looked at transgenders. So their voices was included in this process. Methods were very, very interesting. We looked at individuals from a systems thinking as well as a design thinking perspective. And so in systems thinking, we really wanted to look at the individuals from a more holistic perspective, really looking at everything that impacted that individual. Design thinking, we did focus groups, and within those focus groups with design thinking, the participants actually became involved in providing information based on the questions, but also becoming a part of the analysis process. And so we had two research questions that drove this research. One was, what were the experiences of people from different cultures and backgrounds related to the opioid and other substances? So what were their experiences? Second research question is, what types of creative solutions would they like to help co-create? So we asked a magic wand question, and this was the magic wand questions in terms of what they would like to co-create in terms of solutions to this epidemic. And so one of the overarching things that the participants really wanted, they wanted to change. They wanted to be able to receive the resources that they need, and they wanted to make sure that particularly healthcare professionals as well as counselors treated them with respect, which traditionally has not been the case. And so they wanted to make sure that professionals were trained in dealing with different cultures, one. Two, that the services also contain a spiritual component. And the third overarching issue was services for not only HIV positive transgenders, but also HIV negative trans persons as well. And those are just a few of the recommendations that were made, but certainly this is just the beginning of having this or these particular vulnerable populations having their voices heard. Thank you.